in healthcare. Empowering the NHS with AI hallmarks a revolution in medical care for a healthier future. Because with AI, better patient care is possible.
Thank you everyone for joining this inaugural webinar today that will be part of a series of webinars on the transforming role of artificial intelligence for healthcare in the NHS. My name is Zarmina Jafar and I'm currently serving as the Head of Strategy at THP Global and participating as Healthcare Technology host for today's webinar. We extend our gratitude to Conservative Friends of NHS for making this webinar possible, along with our guest speakers who will be introduced shortly. Today's session is around the topic of artificial intelligence and its potential to transform healthcare in the NHS, followed by a Q&A session. This session is being live broadcasted on YouTube, LinkedIn, Twitter, and Facebook. I would like to start with inviting on and giving a very warm welcome to Dr. Sandesh Gulain. He is a Scottish Conservative MSP for Glasgow and the Scottish Conservative Shadow Cabinet Secretary for Healthcare and Social Care. He is a valued supporter and a good friend of Conservative Friends of NHS. We thank him for his enormous support and his presence today. We are honored to have him in our first inaugural webinar. Welcome, Dr. Sandesh.
Thank you. So, what I want to just very quickly say, if I may, is that when it comes to AI, what we're looking at, it's actually something that we need to look at as a four-nation approach, because healthcare is different across our four nations, and the use of technology, it's vital that we look at this across our four nations and we work together as opposed to what we're doing at the moment, which is working in silos. Oh, sorry. Sorry. I think yes. Right. Sorry. Okay. So I think what I'd like to talk about is, so we all saw the video, and the video talks about when you use AI and AI is used for empowering doctors, for ensuring that it augments the work that we do instead of replacing doctors. I'm a GP, and I'm still a practicing GP. But actually, can we just go back a little bit and let's look at what AI can do outside of medicine? Why don't we look at what AI can do for us in the efficiency world? So my vision is for a modern, efficient local health service in Scotland. But how can we use AI to be more efficient? Well, one of the things that we can do is we could use AI to make sure that you've got the right patient in the right theatre at the right time with the right kit with the right staff. So none of this is using AI to look directly at medicine, to look directly at clinical work. It's using AI to make sure that we've got everything we want at the right place. We use AI to make sure that when you've got that you can make sure that the AI gets the orders right, the right kit in place. We use AI to look at how patients flow through a hospital. So we all know that if people in business and people in supermarkets, especially, they know how people walk through their supermarkets. They know exactly, through a lot of science, how you go from one place to another and the way that you walk and how you track it, and then the best places to put their goods. Well, in a hospital, we can track the way people walk. We can track the directions they go, the flow of our hospital, the times. And by doing that, we can make things more efficient for our staff. We can make things more efficient for our theatres, our clinics, and make sure that we're getting places in an efficient way. And if you look at some of the work being done at the moment when it comes to drug rounds, there's a track for how our nurse goes and all the places that our nurse goes during a drug round. And what you can do is minimize that movement to maximize the work that is being done, which is at the top of our nurse's license. So that's all the stuff that we can do That's got nothing to do with medicine and clinical work. Okay, I think this is one of the most exciting parts of AI, because we can do that right now. There's no reason that we don't do that right now. If we then move on and we talk about how we can use AI, how we can use technology when it comes to actual clinical work, well, this is when things truly get amazing. We can start by ensuring that we free up our staff time. So look, we all know about radiology. This is established already. Radiology, looking through X-rays, CTs, MRIs, and flagging up the ones that doctors need to look at. But what about if we use AI to look at how our blood pressures are being monitored? We have wearable 5G technology, 6G technology coming in. We start blood pressure monitoring, and that then sends it off to a database. The database checks how our blood pressure is fluctuating, and it picks up on the algorithm and it flags it to a nurse to come and have a look at us. We use AI to see what things are like when it comes to diabetes, when we're at home, and the tech that is coming out. The possibilities of how we can use AI to enhance what doctors do, what nurses do, is almost endless. It's just up to us to use it in the appropriate way. And again, and I go back to this, and I keep coming back to this, this is not to replace staff. We will always need staff. We will always be short of staff, let's be honest. But we need to start using technology in its truest sense to make sure that our NHS, both in England, in Scotland, in Wales, and Northern Ireland, is fit for purpose and fit for the 21st century. And if we do that, then we're going to see a significant improvement when it comes to health and healthcare delivery for our patients. And I'll leave you with my thought about what Steve Barclay said at Conservative Party conference. We were both talking at the Spectator event about AI and about data, and he has said that the top floor of the Department of Health has been cleared out, and he's cleared that out because it used to be offices for MPs, but he's cleared it out now because what he wants is that to be an innovative hub. He wants that to be an area where NHS England is innovating, it's data driven, it's getting AI, it's getting technology into places. And if that's something that our health secretary is championing, and something the health secretary is trying to get in as quickly as he can, then I think it's incumbent upon the other nations. So I'm Scottish. What we want to do is make sure that our health service attaches itself to the English health service, because England is going to have more money than us. It's a bigger department. There are more people. Attach ourselves to it and get work off the back of what England is doing. And I think that we're going to see a fantastic improvement when it comes to healthcare if we're brave and if we put the money in up front. And with that, I will stop talking.
Thank you so much, Dr. Sandesh. That was a wonderful opening and thought-provoking, with a lot of key points that will inform the upcoming panel and Q&A that we're about to have. I would now like to welcome Dr. Suhail Chughtai to present the keynote talk. Dr. Suhail Chughtai is an orthopedic surgeon based in London. He has over 20 years of experience as an AI and telehealth strategist. Dr. Suhail is MIT certified in AI for healthcare and has got a fellowship in clinical telemedicine, and is also Microsoft certified specialist. He's also the digital health director for Conservative Friends of NHS and CTO of the Health Bank UAE. Welcome, Dr. Suhail.
Thank you very much. I appreciate the effort taken by all of the people who've come in, especially MP Sandesh Gulhane. I know it's the Diwali night and you must be very busy, but thank you very much for coming up and supporting our effort. Dr. Chohan has been putting a lot of effort. Dr. Saima, Dr. Bakshi, and other people are really supporting. So your presence today is very symbolic. Thank you. I'd like to take a moment to just introduce the importance of why we're doing it. We're doing it for two purposes. One purpose is to embrace the technology and show our support towards it. At the same time, we want to develop a culture of information and sharing information between all of us. Whatever I am aware, whatever other people know, if they're interested, we can all exchange. So it's not teaching, but it's exchange of information. And I will endeavor to do my bit of presentation here, and then we have a question and answer session. We can also take questions from people who can ask by their chat boxes or by their comments in their Facebook, social media, YouTube, and Twitter accounts. It's going live in 4 media at the moment. So thank you very much, Zarmina, for inviting me. I'm just going to take a moment to share my screen, and then I'll take a shot. So can you all see the screen? Zarmina, can you see the screen?
Yes, thank you.
Thank
Perfectly.
you. So I dive straight into the first slide, which is the website of Conservative Friends of NHS. And this is where the brilliant work in the past has been witnessed and signatured. Dr. Ashraf Chohan has started this 2 years ago. It's growing, catching momentum. So current challenges, what we have, NHS, besides being one of the best health services, state-run health service in the world, has challenges. Let's exemplify that. Funding pressures. Despite increasing 3.8% in the NHS funds in 2022-23, the needs are still unmet. The staffing shortages, 9.7% vacancies are at the moment. This is the status today and this year. So if there are 10 seats, 100 seats, then almost 10 are empty. And in nurses, it's even worse. It's 11.8%. The waiting times, now that is a staggering, sadly very staggering figure. 6.7 million patients are waiting for hospital treatments. That is September 2023. And those who want to go to outpatient department to see a specialist, that's 4.1 million people in September 2023. Bed shortages, another problem. The recommended is 85% occupancy to keep 15% for calamities. At the moment, 95.7% in October 2023. Social care crisis. UK has very aging population, and that is where the challenges are. 10.2% vacancy of the staff at the moment. 600,000 patients waiting for social care assessments. That is very sad that despite the efforts, we are facing this. There's a rising demand because the population is aging. There's a rising prevalence of chronic diseases, possibly because we are diagnosing it quicker, we are more efficient to diagnose. There's new technologies being implemented. So that is a pressure itself on NHS systems. Whenever there's a new technology implemented, there's a new team required, new training required, experiments, mistakes. So that pressure is there. And then at the same time, the public expectations are rising. As you perhaps know, that litigation in UK is on the rise for medical negligence. And that is one reflection that the people are expecting more from NHS now. The pandemic has left its footprint. Financially, NHS has shown signs of exhaustion. Staff and supplies, they're all showing side effects of what we went through. And there is a post-COVID mental health strain, not only for people who got infected, but people who recovered from that as healthcare professionals, their loved one dies. And I know many of the doctors who have lost their lives in this pandemic. One last thing on this pressure on the NHS is the outdated infrastructure, which is not helping at all. Because of that, we have reduced efficiency. We have increased maintenance costs. Old equipment takes more to maintain. There is reduced capacity because of the old equipment, and the staff morale is actually affected by that. When they see the same blood pressure cuff, the same equipment over the years, and they see other things shine nice and shiny on the internet, on the private hospitals, their morale is affected. So how can digital health modalities, particularly AI, transform NHS? So let's take an example of access to primary care and specialist care. This is one area which is affected, access to primary and specialist care, because of the pressure on NHS. People are waiting 6 hours, 8 hours, sometimes all day, 10 hours in the A&E for simple things like ankle sprain, like wrist sprain, like innocent looking headaches. And that is actually very inefficient. That is where, if we can develop, in fact, this is the topic of our next program, that how we can develop a triage from home for A&E systems. And I have actually a paper to present as well, that a system has been designed, which is almost ready to be presented to NHS, that how can we do a triage of A&E patients at home, and what is the parameter and what are the logistics behind it. Then the outpatient appointments, I mean, let's imagine a patient with knee pain taking regular Brufen or Proxen, and he's got 9 months of waiting list time for knee replacement. That is very depressive for that person who knows that he has to take 9 months of painkillers more. He hasn't got private cover. That is a dilemma. So for that, I did a couple of pilots in UK, and most of the work in telehealth and AI for the last 20 years has been outside UK, but almost 10% has been within UK in private sector. And I did set up a clinic of dermatology in England, in London. We had an online dermatologist in Hull, because the waiting time in London was high. So the dermatologist in Hull could see the patient because he had a shorter waiting time. And that way we were very efficient. We were able to solve long waiting time to less than 6 weeks. Elective admissions. When you can't discharge a patient on the pretext that what will happen to the patient if the blood pressure is not monitored. Now, if we have a virtual home care system in place, not as a novelty, as a necessity, not as an add-on, but as a complement of the system, then the patients can be discharged early, can be monitored, and they can be still be safe in the safe hands. And I will explain that in the next few slides more. So the second target which digital health can achieve is quality of healthcare under pressure. We can sustain the quality of healthcare under pressure of high demand if we have tool of digital health, because that can circumvent some of the pressures, it can automate some procedures, and that allows less dependence on human resources. Humans can get tired, they can get depressed, they can get angry, and they have a limited working memory. Artificial intelligence knows no limits of working memory. The staff training, AI has the capacity to create on-the-go schedules, which means that you don't have to take time out for some MCQs. Your own cases can be the MCQs. It can create scenarios, and I will present this in one of the webinars coming ahead. Then we can automate the triage and virtual home care technologies. This is such an area to work with. It's so exciting that you collect very neat data, you present highly efficient data, and let the critical decisions be made by the doctor, rather than the doctor asking all the basic questions and seeing only, let's say, in 1 hour, 6 patients. In that way, the doctor can see probably 10 to 12 patients in 1 hour if there is an automatic triage or virtual home care technology. Again, today's program is basically warming up. We are inviting thought leaders, and we want to gain momentum to go into the deeper layer of all of these technologies. And of course, we can streamline the processes which are around the healthcare. For example, staff rostering, bed management, budgeting, inventories, and all that. So what technologies of digital health can come to rescue us, can come to rescue NHS? Telehealth. And as you all know, this is virtual consultation with embedded electronic medical record and clinical decision support system. Mobile health. There are healthcare apps maintaining healthy lifestyle and monitoring health parameters. Then this is a relatively new area for UK, but it should be adopted more heavily. It means we can hospitalize a patient at home. This is something I want to delve into deeper layers. and go into the nitty-gritty of that in one of the webinars. Artificial intelligence empowered healthcare systems. This is the primary topic of this series of webinars, that how AI can generate both traditional AI and generative AI, both natural language processing and machine learning. How can they help us make NHS more efficient? So traditional and generative. The virtual reality, augmented reality, which is basically rendering realistic imagery with dynamic control for efficient training. Robotics and mechanical automation, so we can have electronic and mechanical automation based on engineering principles. And this is a very good tool to create innovation, and not just to create innovation. We don't have to go to kind of make a totally replacement, totally robotic. It can be robotic assisted, so that we can win the patient's trust. So, I mean, now narrowing it down to AI, there are different elements of AI. I don't want to go into the AI details. This is not the context of this particular webinar, so I'm just going to do a flying detail, touching detail of AI. Machine learning are basically the algorithms that learn from data to improve the task performance without explicit programming. I tried to narrow it down to one-liner definition. Because we'll be using these terms in the coming webinars, I thought I'll just put this for reference. Computer vision, another type of AI, where there is ability to process, analyze, and understand digital images and videos, like telepathology, teleradiology. This is very exciting. Natural language processing, NLP. That's the ChatGPT, the Claude, the PaulMed, the Bard, and all these generative AI versions. They can think like humans and they can answer you. That is generative AI feature of natural language processing. Robotics, development of machines that can physically interact with the world. Expert systems, where we have multiple programs who can make decisions. It's a combination of traditional AI, where we detect changes and patterns, and then to solve problems by creating novel ideas. So generative and traditional AI can mix together here, create expert systems. And then planning and scheduling can be again AI run, which means that it can predict when the inventory is going to be revised, when the budget is going to be narrow, when the beds are going to be difficult to save, and all that. So the evolution of AI has led us to one particular point. The traditional AI has been in system for more than 20 years, but that was based on logical programming and coding, which means that it can detect patterns. It can detect SV-TAC pattern. It can detect atrial fibrillation pattern. It can detect Reed-Sternberg cell, oat cell carcinoma, certain text information. But that we require structured data. We need to present data in a structured way. And the outcome is more or less predictable, because we know if this is found, that will be the outcome. And there's a dependency on the human supervision. But contrast is generative AI. It works like human brain. It generates pattern, like novel ideas. For example, how would cricket be played on moon? It can generate a pattern. Structured data is not requirement. Plenty of data is. It is very contextual. It is very creative, because it creates novel ideas. You can say to ChatGPT, give me a unique idea to make a presentation on telehealth for experienced people. It will generate a new idea. And there is lower dependency on human supervision, and that is a dangerous part. That's where regulation is required, because self-adaptive algorithms, if there is a robot which is solar powered, it will refuse to turn off. Have you watched the movie Megan, where a father buys a doll, a robotic doll, for to play with the girl, his daughter, and the robotic doll reprograms itself, and it thinks that everybody approaching faster, closer to the girl is a threat. That is adaptive learning. And the new movie of Tom Cruise, the last one, Mission Impossible, again showed a lot of computer learning, adaptive learning. So if it's in the movies, it's going to happen, as you know. Star Trek was once a movie too. So I just want to take a quick touching of the areas we'll be touching in the next few. We'll be going in detail in the next few webinars, that how AI will change the landscape of NHS. AI will help us to diagnose medical conditions and surgical conditions by picking up patterns. By picking up patterns, whether waveforms in ECG, EEG, or by different scale, different variations of a cancer cell. And that is so relaxing on the human intellect. People can be stressed, people can be tired, people can be sleepy, people can be overworked. Computers are not. The predictive analysis, where there are so many multiple parameters put in a system, and humans are unable to deduce results if 2 or 3 things go wrong at the same time very efficiently. People take time to find out what is the relation of A going wrong with the B going wrong and the C also going wrong. What started, what triggered the chain? But if we can put this data to artificial intelligence, natural language processing systems, then it'll detect the pattern. And those patterns can be repeated. When A goes wrong, B is likely to go wrong, and C will go wrong. That will be a warning. And that is early warning score system. And Rothman index. I mentioned about the virtual home care system. I designed a system where people can detect and predict the risk of patient going back to hospital. Patient being monitored at home, that patient can be risky to stay at home, can go back to hospital. And the patient who can safely stay at home, that is also on the Rothman index. In fact, this is an established algorithm in America. And I have designed a little variation of that, which I want to discuss with colleagues and then take their input as well in the future webinars. And then that is the idea of doing this all, that if they have ideas, we can suggest to NHS eventually that this is what we all think collectively. And this is where the Conservative Friends of NHS and the ideology is coming, that how Conservative Friends of NHS can help NHS in making more efficient systems. The differential diagnosis part, as you know, that a doctor can be presented with possible 3 or 4 key diagnoses before the doctor can make a critical decision. Doctor can overrule that 3 or 4 options, but he will be presented with very neat data. And that is the idea of generative and traditional AI, which is again artificial intelligence role. So how can AI empower medical treatment? Medical treatment empowerment can be personalized, can be precision medical therapies. Genome scanning, as you know, there's a lot of data burning, data crunching, and that is where AI can find relationships. Once there is generative AI, it'll find out the patterns, that what connects what. So it'll cut short the time, and the drugs can be invented faster. We can leverage medical records and health data. There's a very good study in one of the Chicago hospitals that they found out what went wrong in the past, what cancers were missed, what breast cancers and uterine cancers were missed based on the data of the past patients. And in future, now the NLP or the natural language processing is detecting that this could possibly be a cancer. So that particular pattern was missed in the past, but now being picked up based on the past medical records. So medical profession is blessed with data.
Can I
Yes, Saima?
interrupt here, because our MSP is going to leave, unfortunately. So just to...
Sorry, who's leave?
Dr. Sudesh Gilani, he has to leave now for his next
so
commitment.
I'll just take a pause here, and I'll invite Dr. Sudesh to come and join back. Let me just bring it back. Just a minute, please.
Thank you.
So discard, and we'll bring it back. Just a second, please. And back to you.
So sorry, everyone. I do have to go. I have another meeting that I have to attend. Thanks very much for your attention. Hopefully, the next time I come on, I'll be able to take some questions and be able to look and take things forward. But it's a fascinating talk, and certainly in the chat, the Tribe project was mentioned, and that's something that actually is a very interesting read. So I'd encourage everyone to go and have a look at that. But apologies, I have to go to my next meeting.
It's very valuable to have you, Dr. Sudesh. Thank you.
Thank you.
So, Saima, you can stay at the next part.
You want to carry on?
Yeah. No, I think it's fine. I was just towards the end of the slides, so let's proceed to the next part. And yes, Zarmina?
Continue the slides.
No, I think it's. I was towards the end of my slides. I am very conscious of the time now. We have half an hour left, and it's probably better if we leave it at this point and then involve the rest of the colleagues here to join us.
Great. Thank you so much, Dr. Suhail. That was great and much appreciated. I would like to formally welcome and introduce Dr. Saima Niaz. She's a consultant psychiatrist and deputy chair of Conservative Friends of NHS. And she has a special and keen interest in raising mental health awareness. Welcome, Dr. Saima. The floor is yours.
Thanks so much, Zarmina, and thanks to Dr. Suhail Chughtai for initiating this. And I would like to first say that the Conservative Friends of the NHS, Dr. Ashraf Chohan, he will be joining soon. He's on his transit at the moment, and he's the founder and the chair of the Conservative Friends of the NHS, which is an organization now affiliated with the party, and it's played a role in shaping the organization and helping the NHS to shape its future. And I would just like to say that CFoNHS, because many people are new here, its continued mission is to engage actively in various initiatives and utilizing this platform effectively to discuss and raise issues related to the NHS, to the healthcare and healthcare professionals, and we're bridging the gap between the NHS and the staff. So we have initiated this webinar series, and we are going to bring more webinars in future with some panelists in every webinar. Today I'm going to introduce them. We have Dr. Mohammed Khattak. He's a very enthusiastic registrar in orthopedics and doing artificial intelligence project. When we'll come to him, I will also request him to say more, to tell us more about it, because he's also working with NIHR as a clinical fellow. And we have as well with us Dr. Rajinder Paul Singh, a very dedicated CFoNHS member. He's a consultant transplant surgeon in Manchester. He's joining online. Trained in abdominal organ transplantation and immunosuppressive strategies in the United States. He was trained over there. He's also a clinical researcher with the several peer-reviewed scientific publications. He has also lead for infection prevention and control, and he has keen eye for evidence-based practice in medical practice in the field of transplantation and immunosuppression. I'm now going to introduce Julie Redman, our very dear colleague from the NHS, and also a dedicated loyal member of the Conservative Friends of the NHS. She's trained as a nurse and worked in NHS A&E for many years, and before getting a degree in pharmacology and working in dermatology after living in Australia and working with skin cancer patients. She was encouraged by her local MP, Nikki Aiken, to stand as a councillor, which she did, and she was chair of her local residents association and worked with different charities. And all through the pandemic, Julie helped with the administration of COVID vaccine and outpatient care. Thanks, Julie. She stood as councillor candidate in West End Ward and is now the GLA Barnet Camden candidate. So now the floor is open for question answers and some lively, engaging debate with everyone.
Can we invite Mohammed, orthopedic registrar, to share some thoughts what he's doing in AI in the NHS projects?
Of course, yeah, I'm happy to give a bit of insight. Hi everyone, had a very kind of nice introduction. That's basically it for me. I'm a academic clinical fellow. I've developed an interest in artificial intelligence. Specifically, my thoughts are within the UK, the NHS, we seem to be lagging behind. There are many artificial intelligence solutions available already with FDA approval. My specific research focus is looking at fracture detection, being an orthopedic surgeon myself, and looking at why exactly we aren't utilizing these solutions within the NHS. With regards artificial intelligence, there are specific barriers to implementation, and I'm trying to delve into specifically why we aren't moving towards this kind of technological advancement. The research frontier has already moved towards FDA approval with a lot of fracture detection systems. Specifically in France, we have Bone View, which is a fracture detection system. But for some reason, and we're not exactly certain why, we seem to be creating barriers, and there seem to be obstacles to this being implemented and deployed. And that's what I'm looking at the moment, looking at why we aren't implementing them, what exactly is stopping us from implementing them, what the health economic implications of deployment are, and whether we can prompt and encourage adoption of this technology. As Dr. Chughtai has mentioned, it's not just machine vision. This is just one small facet of the potential AI solutions that we could be adopting. NLP, such as ChatGPT, and robotics are also other potential pathways. The kind of only one within the NHS field which I can see quite openly being used at the moment is AI robotics. We do have very limited use of machine vision in the form of diabetic retinopathy detection software in ophthalmology. But I think within orthopedics, there's kind of a vast array of potential uses which we need to start breaking down barriers and moving towards adopting them. So that's what my research interest is.
That's very elaborate, Mohammed. I know your good work. You're very keen on AI, and the way you're managing it has the potential to take off further. Thank you very much. Can I invite Mr. Singh, please, to say a few words and his experience of using AI in NHS? Mr. Singh, please.
Thank you, Suhail. Thank you, Saima. Thank you, Dr. Chohan. It's really nice to be here in our warm group of CFoNHS. Suhail, wonderful presentation.
Thank you.
We recently have had a taste of this AI, for instance, Epic, the system that we use for data management. So prior to that, in Manchester, we had several sections where the data were all conjointed. And now we have got all of that under one heading, and the system has become extremely efficient and smooth. The patient flow and the pathways are all streamlined. And more importantly, data collection for publications, even data collection for medical legal aspects to prove what was done at what point, the transparency, everything is standing out with sheer brilliance. So certainly this is the way for the future. However, the amount of money that was paid is also huge. For instance, I think from sources, it's around 150 to 180 million pounds to purchase such expensive thing. So the question is, when is that going to break even in terms of justified cost? One question I have for you, Suhail, is, this building up of AI intelligence, it is contingent upon having robust and large data collections. And when you go for large data collections, certainly you will risk breaching patient confidentiality and patient privacy. And that's a very big issue about data breaches. So first question to you would be, how are we going to address this important aspect of breach of confidentiality and data breaches and patient privacy? which is basically dependent on, data collection is dependent on this only. And the second thing would be insurance. Insurance companies, if they get to know your genetic composition and using AI intelligence, they may decline insurance to a certain group of people who are vulnerable because of their genetic predispositions. And AI would simply lead them on to say, well, let's not give insurance to these. So, how would you address these two challenges based on your extensive knowledge and research? What are your thoughts, Suhail?
Mr. Singh, it's a very touchy zone. You've touched at the very beginning of this series, so it's pretty rocky area to discuss about, especially the security of patient data. When you have gold, you want to keep it safe, but when you want to make jewelry, you have to get the gold out. So there is a sensible limit of safety. But if access is helping a bigger cause, you have to balance between the two. So I'm not saying that AI systems are not safe, but of course, it allows access to people who are committed to work, the data is there. But the recent past experience has shown that the benefit is bigger than the risk, which is encouraging people to go into this and keep doing it. But I agree with you that regulations will evolve and will take a more stringent shape. For example, ICO, HIPAA, GDPR, they will evolve around this risk which you just mentioned. So I respond in this way that risk is there, but is the benefit bigger than the risk? And that is the question we need to learn and probably see how it goes. The second part was the insurance companies. So see, this has been going on since the insurance companies came into market. They want to know from the neighbors, is he drunk in the morning? And things like that. So that culture of insurance companies will always remain, knowing more about the person they insure. How can we stop it? We can't. I'm being very honest and blunt, Mr. Singh. Maybe this is not the very politest of the answers. Yes, insurance companies will pry into this. There will be some people on the disadvantage. But at the same time, is it not that they will also know that this person they can insure cheaply because he's got better risk of surviving? Let's say a person at the age of 55 gets a stent put in, but he's got other vessels all right, he's got other parameters fine, but the insurance company refuses insurance to him because you've got a stent put in because of the general rule. But AI allows a window for that person to have cheaper insurance as to a person of 40 years age because he's got no other parameters risking him to higher premium. So it's both ways. Have I answered your question, by the way?
Absolutely. So I totally agree with you. It was more, just kind of a throwing question just to, open up a discussion system to see the pros and cons. And what you're saying is right. The benefits significantly outweigh the disadvantages. And I think slowly an ironclad system can be brought in so that will, address the issue of patient privacy. And another example is the insulin pump, for instance. I'm a pancreas transplant surgeon, and gradually now the solitary pancreas transplant numbers are diminishing, and the pancreas transplantation is a very high risk operation. And so if it's a kidney and a pancreas, it's justified where you give immunosuppression as a trade-off for insulin. But for those patients who are simply diabetics but do not have end-stage renal disease, and if we are going to transplant a pancreas, then it's basically kind of an overkill nowadays because it's a high-risk operation. And here, the artificial intelligence has kicked in, and in the last few years, the insulin pump and the robust management of diabetes is so good that many diabetologists are not even referring patients to us, well knowing that this could be a high risk venture, and why not just use AI. So clearly there are areas where AI is winning significantly, and I think the future holds very bright for this sector. So I would let other panelists join now. Thank you.
Julie, you have been a nurse and you have also have education of pharmacology. How do you see AI transforming the nursing system as far as your experience of nursing is concerned?
Well, first of all, I want to thank you for inviting me this evening, and it's absolutely fascinating. And I really, listening to you, it's something that the NHS would benefit from hugely. For me, when I look at my colleagues working in A&E, and they're incredibly tired, and depressed with obviously different kind of mental illnesses after COVID. I feel that they need every bit of help they can get, and if this technology, cuts waiting times, helps them, with their patients, whether it's writing up notes or just having a triage system in place that they it just lessens their workload. I think it will absolutely be a huge success and benefit. For me, I think I don't know a huge amount about AI, so I'm not going to pretend I do. But listening to you tonight, I think has been really, really great because, yeah, and I don't know why actually we're so behind. And it was interesting, what Mohammed said about the fact that the UK is behind. And I don't know why that is, because obviously, a lot of money has been put into the NHS, and the nurses, the doctors, the multidisciplinary teams working within the NHS are just not seeing that and seeing the benefit of that. So I think it'll be really, really great. I was going to ask you actually, just out of interest more than anything, obviously when you're designing the systems and you're looking at how it can help different multidisciplinary teams, do you engage with groups of we'll say physiotherapists, nurses, to hear how they feel, how it could help them, mostly in their roles?
Thank you, Julie, for asking a question. Yes, I think it's very important to have an integrated team, a multidisciplinary team. Things are linked together. A person who has been on the waiting list for a long time could develop mental problems, can develop gastrointestinal issues, can leave the country to get treatment in some other place. So all of the systems need to be in sync.
Mm-hmm.
The AI systems have this capacity to work while we sleep. And that is the very capacity, the working memory of humans. We cannot have a quick recall of thousands and thousands of pages when we see something. We recall what is available in the working memory. What is not, we have to go and think. AI systems don't work like that. For them, the whole data is their working memory. Thousands and thousands of pages. They can recall that segment, that connection, that link, that integration quickly and say, look, this is going to go to SV tag. This could be a precursor to fibrillation. So the answer to your question is yes, we have to involve multidisciplinary teams, and we have to educate them not only on AI, also to know the limitations of AI. Because at the moment we are learning. We are not masters in AI. Generative AI is just a year and a half old. So I hope the answer to your question is quite long. Yeah. I'll try to keep it short because I have some questions which I want to take up before we close. If Dr. Saima, are you happy to take some questions? One of them is on the screen for you from Hina Tashfeen, that AI solutions can be quite straightforward in fields like radiology, but are there any AI algorithms for early detection of mental health disorders? How can you pick up AI mental health disorder early, and then the natural language processing can involve that? So can you perhaps hint that? You're a psychiatrist, so I put it to you.
Oh, okay. I was thinking I was going to read the question. Yeah, so I was just going to say as well that it's AI is very useful, like in predictive analysis and in administrative tasks, rearranging appointments. Virtual assistants powered by AI are being utilized to provide information to patients. Like I said, reschedule appointments, offer support for mental health and well-being. as well, because loneliness is, as we discussed, loneliness is one of the biggest factor in UK as well, for depression and even for old age people going into severe depression and then suicide and other complications. So AI, what I remember, Dr. Suhail, you were talking about AI into addressing patients, some social aspects. If you want to,
I just want to add to that one thing more, that yes, AI can detect the nasolabial fold deepening in the serial images. A person going into depression, AI can detect that my voice is getting deeper and slower from the last consultation. AI can detect that I've got darker circles around my eyes categorically. And that can predict a report that this guy you interviewed last time is possibly living lonely and he's overthinking, he's not in the state of mind, he's not fresh enough, he's a loner. So he can suggest multiple things. And then, of course, the suicide index and all that, AI has already worked on that. I hope I answered the question. I have answered the question, Saima, as well. Ramin Atif asked how AI can improve medical legal practice for medical reporting organizations and DME. That is actually a question which is, I also practice medical legal, so I just want to take this and answer this question. If you have 20,000 reports, for instance, and you can find out that if the person, which postcode was developing higher incidence of fall in the store, where people are falling more in the superstores, when people are hit from behind, do they get more back pain or neck pain? And what age group gets more back pain and neck pain? So all those reports of past can be put through a natural language processing, rules can be made, and then predictions can be made for more accurate recovery periods in future. So yes, the answer to your question is yes, Ramin. There is a lot of work being going on. I'm actually involved in that, this being one of my fields, and you will see some papers published very soon. There's a couple of more questions I want to take before we close. We've got 7 more minutes. One question which has come is, let me just pick up this one.
And can I check, because I have seen sometimes resistance whenever there is a change in the NHS. In some places, staff are resistant, or they go into stress or feel then there's quite sickness or difficulties at workplace. How we are going to manage this, manage the change with AI?
Anybody else? Mr. Singh, Mohammed, do you want to take up this question?
I think that one of the advantages of AI is that many youngsters, they will be more keen to engage with an artificial machine rather than a real human being because of confidentiality. And it's a bit of a sad thing to share with you that when we look at organ donation, about 15 to 20% of our donors come from youngsters who do self-harm, and probably they do not have anybody to speak to, and they are hesitant to speak to a real persons. So AI probably can help there, because they will be more free to talk to some some interface which is not a human. That's one area where I can think of AI probably can score better, and I think Saima may be able to address this far better than I can, but this was one AI aspect I could simply pitch in. Thank you.
Thank you, Mr. Singh. Pravesh Day has asked a question. Sorry, Mohammed. I've got a question coming up for you as well, Mohammed.
Okay.
So I've got a question
just on that last point, I just wanted to address. It was a very insightful question. It's a very good question that kind of falls under the banner or umbrella of human behavioral change and implementation science, and that is the crux of the barriers to implementation. It's not just patients; it's clinician, it's kind of management, it's stakeholders. They all people struggle with change. And we don't have a simple question for that. That's kind of falling into the remit of what I'm researching at the moment. How we can overcome these barriers, what the barriers are, and how we overcome them. But it's a very, very good question.
And Mohammed, also remember the explainability. How did AI reach that conclusion? That trust has to be developed, and then the bias that there are certain biased results of AI. So over the years, we will develop more trust. We have got 5 more minutes, and I want to take this question from Pravesh Day. Can you please highlight some generative AI application or use case landscapes in UK? With your permission, if I can answer this one, this is a very this is not a question. This is actually a day-long discussion, but I want to just keep it to 2 minutes. Generative AI, remember, creates novel ideas. So if you give a structured, a non-structured, or structured data to that, it will pick up the uniqueness of that pattern. I'll give you one example. You are studying and you want to have a revision of your project. You can just say, can you give me the salient features? Or you can say that the prompt can be, act like a 5th-year medical student and pick up the points I must know before I go for my exam. So it'll get that particular 5 or 6 things which are being asked in the exam, which are known to be asked in the exam. Or you can say that I have a long clinic tomorrow morning, and give me some ideas, how can I be more time efficient? It may surprise you. So this is a big discussion. Talking about radiology, you can give old MRI scans and pick up where we missed, for example, chondrosarcomas. The MRI scan was false negative. So you can reduce the false negatives and false positives by subjecting imagery data and say, well, look, you were wrong here. Correct yourself. What did you miss? So that will pick up that miss, and in future, you will not miss. And that is the benefit, the real change, I suppose, AI can bring. And may I take just one last question for Mohammed? This is for you. You are very enthusiastic about AI in orthopedics. Take up this and answer it, and just satisfy the person there, Azir Khan.
Yeah, there's loads of courses. I think it's such a novel research frontier that you're going to struggle unless you actually seek out these courses and conferences. For example, the second Orthopedic Research UK AI and Orthopedic Surgery Conference is being held next week, in fact, on Monday and Tuesday, the 6th and the 7th. And that's in London. So that if you want to go to a conference, it's got a workshop on the Monday, which is a full day workshop with kind of the fundamentals of artificial intelligence, and then on the Tuesday it's the conference itself. So that's a perfect starting point for you, and I think there are spaces still available for that. In general, if you're looking for artificial intelligence courses, there are some good virtual courses online. You can find some on FutureLearn. And if you look at, for example, Harvard, they do a beautiful course on designing and implementing AI solutions in healthcare. That's one I attended recently, and that was very, very nice. So you kind of really need to seek them out. But if you want orthopedics and AI specifically, a good starting point would be next week for that annual conference.
Thank you very much. And with that, I give it back to Saima to close this, and then we carry on from this point.
Thank
Yes,
you.
Saima.
Thanks, Dr. Suhail Chughtai. And I first would like to thank our MSP, Dr. Sandesh Gulani, who was earlier with us, though he's not right now with us. We are really thankful for his presence with us. He had to leave for another commitment. And our panelists, Dr. Raj Singh and Dr. Mohammed Khatak, Julie Redmond, and thanks, Zarmina, for opening the session. We are so glad with the participation of our so many audiences who joined online, and we are looking forward to involve our conservative friends of the NHS, more members into this, bringing them onto the screen and getting them involved in this interactive discussions. And Dr. Chohan, I think he's having difficulties in joining in. He's always there to support us, and it was his initiative, another initiative, and bringing Dr. Suhail Chughtai on board, and a part of now he's a part of our organization thanks to that. So I would like to thank everyone who has joined online, and this will be available, recording will be available, and we are looking forward to have our next webinar on 8th of November, Wednesday, 6:30. Thank you.
Thank you.
Thank you, Zarmina. So you want to close and maybe give us the date of the next one?
Sure. Thank you, Dr. Suhail. Once again, I'd like to thank all our speakers and our audience for your attention and contribution to the discussion today. We hope you will join us next week, same time, same platform, on the 8th of November, 6:30 p.m. UK time, for a deeper dive into this subject. Thank you, everyone.
Thank you. Bye.
Thank you.
In NHS healthcare, the quest for better patient care is never-ending. Artificial intelligence has a transformative influence on healthcare. AI helps him analyze patient data faster and more accurately. This leads to precise diagnoses and personalized treatment plans. AI also helps in predicting potential health risks. This proactive approach improves patient outcomes significantly. AI is not replacing doctors, but empowering them. Together, they are revolutionizing healthcare. Empowering the NHS with AI hallmarks a revolution in medical care for a healthier future. Because with AI, better patient care is possible.